Good morning, everybody. I think we should start. It's 10:30. My name is Patou Musumari. I'm an assistant professor working with Professor Kihara. And today we're going to see some basics of infectious disease epidemiology. So we will particularly look at few or some theoretical backgrounds on how disease spreads, but also on how we can control infectious diseases. And some of the very important concepts will be explored. The reproductive number, you will learn about it, and herd immunity. And in the second part of the lecture, we're going to I will introduce you to the mathematical modeling of infectious diseases. You know, what are the different steps involved in building a model. But before we get to that, I thought it would be really interesting to say some words about the pandemic influenza of the 1918-1920. It is generally known as the Spanish flu. I don't know if you ever heard about it. It's a very important disease to mention here because it has caused a global mortality that is more than any other pandemic since the bubonic plague or the Black Death of the 14th century that you have probably seen in one of your previous lectures. 1918, I'm sure many of you will remember, it's almost around the end of the First World War, and in which the United States was involved. And it all started here in this camp. They call it Camp Funston in Fort Riley, in the east side of east coast of the U.S. What happened is that on April 4, 1918, a soldier by the name of Albert Kitchell, he was an army cook in the military camp. He got sick with early symptoms of flu. Actually, it was the first reported case of the Spanish flu in that year. What follows is that on April 11, his symptoms got much more severe. He had sore throat and cough, very high fever, and his body was aching all over. And then he was admitted in the hospital. So let's try to look at it in a timeline. On March 4, he developed the first symptoms of flu. On March 11, that was in the morning, he was hospitalized. And on the same day, at around noontime, around 107 new cases with very similar symptoms were registered in the same hospital. And on March 15, which is about 10 days from March 4, there was around 522 new cases, and some have developed very severe pneumonia and died of it. Because the army, the troops were sent to Europe, so the infection rapidly traveled from the America to Europe. In May 15, it started in France. May and June 1918, most of the European countries had reported cases of pandemic influenza. Also in May 1918, some African countries were already hit by this pandemic. July, August Asia was also hit through India and China. This is in one of the places in the hospital where patients with pandemic influenza were kept. You can see how crowded it is. And obviously the hospital was overloaded by the number of cases that came up every day. Those are some collection of pictures that I had for you. And this here, it's showing a medical personnel giving treatment to a patient who was diagnosed with influenza. This is in one of the barracks where soldiers stay. And you can see that their beds are separated by those sneeze screens. And this is one of the measures that was taken at that time to try to control the spread of the infection. And here it's a sign showing the number of cases and death at the Novolev Kurt factory. They're also saying don't spit, because at that time it was believed that spitting was one of the ways that the influenza was transmitted. So that's why they were urging people not to spit. And this is in one of the hospitals in the battlefields in Europe. And this is where they were putting patients with influenza. And this picture here showing a nurse wearing a mask. It's kind of signifying that they knew that the influenza was obviously transmitted by air. And she's filling a pitcher from a fire hydrant. As I say, it was a very, very deadly pandemic. And it is estimated that around 20 or between 20 to 50 million people died from this pandemic. And it took the lives of around 43 soldiers compared to 43,000 soldiers compared to 54,000 who died in the battlefield due to fights. So it's killed almost as much as the war itself, showing how epidemic can be very, very disastrous. And this is Tahiti. It's a small island in the Pacific. It is said that 10% of the population died in only 25 days. This is unbelievable. And another small islands in the Pacific, it's Samoa. 20% of the population died in only 2 months. But from the Spanish flu in 1918, there has been a lot of others pandemic influenza. We had the 1957 H2N2, the Asian flu, the Hong Kong flu in 1966, and we had the Russian flu in 1977. And the most recent one was the 2009. I'm sure everybody remembers here, the 2009 swine flu. But the world has witnessed many other emerging and re-emerging infections that you are well aware of. We have HIV, Ebola, that happened in West Africa recently. SARS, which means severe acute respiratory syndrome, in 2003. Poliomyelitis, which continues to to prevail in some of parts of the world. The dengue fever, I remember there was an outbreak in Yoyogi Park a few years ago. And now people are talking about Zika virus in Brazil, meaning that we are still at risk of those infectious diseases, and other emerging and re-emerging will continue to prevail. Okay, they say a picture can say 1,000 words. Let's see some of the pictures. Those are medical workers on the plane that came from Mexico in China, Shanghai, and they were checking people for signs of fever as a way to control the epidemic of in 2009. Those are workers spraying pesticide to kill mosquitoes in Tokyo's Yoyogi Park because there was an outbreak of dengue fever. And this is also a way to control the epidemic by destroying the vector directly. These are groups of Red Cross workers in Sierra Leone, one of the Western African countries that was hit by the Ebola epidemic. And they went here to check the house of a woman who was suspected to die from Ebola. And they had to take some samples. You can see them and the neighbors watching over about what's going on. Other Red Cross members here with a body of a man who was suspected also of dying from Ebola. So they were carrying him somewhere for very safe burial because they had to avoid contact with the body, the deceased body contact with the community, because this is one of the way Ebola can spread. And some of the practices in the region was that people are so much in contact with the dead body because they have to mourn. By mourning, they were being contaminated. So we had to avoid contact with the deceased body. This is a checkpoint where people would be screened for fever, any signs before reaching to another place. That's also in Sierra Leone, August 2014. And this is a health worker of the government of Sierra Leone keeping records of the quarantine in their checkpoints. So as you can see, from the pandemic influenza to recent epidemics of Ebola or Zika virus, there is something very common, is that infectious disease can transmit from one person to the other. This is the most important characteristic of infectious diseases. And that's what makes it different with other diseases like diabetes, which cannot be transmitted from person to person. Now that you have an idea about all that, let's look at some theoretical backgrounds of infectious diseases, which will factually help you to understand how disease spread in a community and what kind of measures we have to take to stop a specific kind of disease.